If your knee discomfort keeps coming back no matter what you try, I want you to consider something important. Please subscribe to my channel. It's possible that some of your daily habits are actually making it worse, without you even realizing it. And today, I want to walk you through a few common mistakes people make, along with simple adjustments that can make your knees feel more supported and comfortable. Make sure you stay until the end, because I'll also share one very common exercise that many people rely on, but for some, it may not be the best choice. Let's start with something very practical. When your knee feels sensitive or uncomfortable, one of the first things you can do is reduce the load on it while walking. Many people try to push through discomfort, but sometimes giving your knee temporary support can make a noticeable difference. For example, using a cane, even for a short period, may help take pressure off the knee. If your left knee feels uncomfortable, holding the cane in your right hand can help balance your weight more evenly. Some people notice that walking immediately feels smoother and more comfortable. This doesn't have to be permanent. Think of it as giving your knee a break while it settles down. And if more support is needed, a walker can provide even greater stability, especially during longer walks. Now, let's talk about how you walk. This is something most people never think about. Many people walk with their knees fully straight when their foot hits the ground. This can send more impact through the joints. Instead, I recommend trying what we can call soft knees. That simply means taking slightly shorter steps and allowing a gentle bend in your knee as your foot touches the ground. You can even try this barefoot at home first, just to feel the difference. Some people notice that this reduces the pressure going through the knee and makes walking feel smoother. It's a small change, but it can have a meaningful effect. Now here's something that surprises many people. If you want to support your knees, you also need to pay attention to your hips. Your hip and knee work closely together, and when the muscles around your hips are weaker, your knees often take on extra stress. One simple exercise is standing leg lifts to the side. Hold onto a chair or countertop for balance. Keep a slight bend in your standing leg. Then slowly move your other leg out to the side. Keep your body steady, no leaning or swinging, just controlled movement. About 10 to 15 repetitions on each side is enough to start. Over time, this can help improve stability and reduce unnecessary strain on your knees. Now, let's talk about something people often overlook: how you sleep. If your knees feel uncomfortable at night, your sleeping position might be part of the reason. If you sleep on your side, try placing a pillow between your knees. This helps keep your hips and legs in a more natural position and may reduce pressure. If you sleep on your back, placing a small pillow under your knees can also help. This creates a slight bend and may reduce tension in the joint. These are very simple adjustments, but many people find them surprisingly helpful. Now, another area that often gets tight: the front of the hip. This muscle group plays a role in how your knee moves. When it becomes tight, it can affect the way your leg functions overall. A gentle stretch can help here. If you're lying near the edge of a bed, you can bring one knee toward your chest while letting the other leg relax downward. You should feel a stretch in the front of the hip. Hold it gently, breathe, and don't force anything. Over time, improving flexibility in this area may help your knee feel more comfortable during movement. And now, let's talk about something very important. There is a common exercise many people use to strengthen their legs, especially at the gym. It's the seated knee extension. For some people, especially if the knee already feels sensitive, this movement can place extra pressure on the joint. And instead of helping, it may actually increase discomfort. So what can you do instead? Focus on strengthening your glutes, the muscles in your hips. These muscles play a major role in supporting your entire lower body. One simple option is a standing movement. Hold on to something stable. Bend one knee slightly and gently move your leg backward, focusing on using your hip rather than your lower back. Keep the movement controlled and small. You should feel the muscles in your hip working. Around 10 to 15 repetitions is a good place to start. And make sure to do both sides, even if only one knee feels uncomfortable. Now here's what I want you to take away from all of this. Knee discomfort is often not caused by just one thing. It's usually a combination of movement habits, muscle balance, and daily routines. That's why small adjustments can make a big difference. You don't need to change everything at once. Start with one or two of these ideas. Try them consistently for a few days. Notice how your knee feels. Does walking feel smoother? Does standing feel more stable? Does your knee feel more supported? Your body responds to how you move and how you care for it. And often, the solution is not about doing more, but doing things a little differently. If this was helpful, let me know in the comments which tip you're going to try first. And if you know someone who is dealing with knee discomfort, share this with them. Sometimes, the smallest changes can make the biggest difference.